Welcome to the deep dive.
Oh.
Today we're going beyond those alarming headlines about inflation and exploring its impact on something truly vital,
Yeah,
your health.
absolutely.
We've got a fascinating
Sure.
scoping review from the Lancet Global Health, and let me tell you, it's a real eye-opener.
Oh, it is.
Yeah.
What makes this research so compelling is that it moves past the usual economic doom and gloom
Right.
and digs into a question we don't often consider.
Yeah,
How does inflation actually affect our well-being?
exactly. And you might be surprised to learn that we're not just talking about tighter budgets.
Right.
This review analyzed a whopping 69 empirical studies
Wow.
with data spanning from the 1800s to 2022, covering almost every corner of the globe.
Yeah, globally, it's really impressive.
Yeah.
The scope of this is incredible.
Yeah, it is.
And the findings.
Yeah.
Well, let's just say inflation's reach extends far beyond your wallet.
Okay.
It touches upon diet, stress levels,
Uh-huh.
even things like suicide rates.
Okay, let's unpack this before we dive into the specifics.
Sure.
Can you give us a quick refresher
Yeah.
on what inflation actually is
Of course.
and how it's measured?
Inflation is essentially the rate at which the prices for goods and services
Right.
increase over time.
Mm-hmm.
What that means for you is that your purchasing power decreases.
Yeah.
That same dollar doesn't buy you as much as it used to.
Right.
This study primarily utilizes the Consumer Price Index, or
Yeah.
CPI,
Uh-huh.
which tracks the price fluctuations of a basket of commonly purchased goods and services.
Yeah.
It's a way to quantify how much those everyday expenses are increasing.
So think about your weekly grocery run
Yeah,
or filling up your gas tank.
exactly.
As inflation rises, those costs go up and your money doesn't stretch as far.
Exactly. And this research digs deep into how those rising costs can have a ripple effect
Yeah.
on various aspects of our lives and ultimately our health.
It's not just about having less money.
Right.
It's about the choices
Yes,
we're forced to make because of it.
precisely.
Right.
For instance, one area heavily impacted by inflation
Mm-hmm.
is perhaps unsurprisingly diet and nutrition.
Mm.
Think about it.
Yeah.
When food prices skyrocket,
Right.
people have to make tough choices.
Now I know what you're thinking. Of course, if food costs more, people might eat less.
Right.
But this research reveals it's much more nuanced than that.
Yeah.
It's not just about eating less.
It's not just about quantity.
It's about eating differently
Yes,
and not always for the better.
absolutely. The research uncovered a pattern.
Okay.
Increased food prices often lead to a decrease in overall food expenditure.
Uh-huh.
This means people are not just buying less food,
Right.
but often switching to lower quality options,
Yeah.
potentially compromising their nutritional intake.
So imagine yourself at the grocery store, faced with the choice between your favorite brand of yogurt
Yeah.
and paying your electricity bill.
Yeah.
That's the kind of dilemma inflation forces on many people.
It is a tough choice.
And it's a choice that can have lasting consequences.
And those consequences can be particularly dire for low-income households.
Right.
For example, in India,
Yeah.
researchers observed that when inflation hit, families with lower incomes had to make more drastic cuts to essential items like
Right.
ghee and oil
Yeah.
compared to their wealthier counterparts.
I see.
These are staples in Indian cuisine,
Right.
and their absence can lead to nutritional deficiencies with long-term health implications.
It's a sobering reminder that inflation doesn't affect everyone equally.
Absolutely.
Those who are already struggling financially
Right.
often bear the brunt of the impact.
They do, unfortunately.
And it's not just a problem in India.
No?
In sub-Saharan Africa,
Mm-hmm.
a similar pattern emerged.
Yes.
After a currency devaluation,
Right.
mothers were forced to substitute imported infant formula
Yeah.
with less nutritious local alternatives.
It's a heartbreaking choice.
We're talking about the most vulnerable members of society.
Yes.
Infants.
Infants.
Exactly. Directly impacted by rising prices.
It really highlights how deeply inflation can permeate something as fundamental as providing nutritious food for your family.
It's heartbreaking to consider those mothers having to make that impossible choice.
Absolutely.
This research really underscores how deeply inflation can permeate something as fundamental
Yes.
as providing nutritious food for your family.
It's about the basics,
Yeah.
the essentials.
And the effects of inflation go beyond just what's on our plates.
It's not just diet.
Let's talk about another major health risk factor,
Mm-hmm.
exacerbated by rising prices.
Okay.
Stress.
It's stress, yeah.
Now that connection seems pretty intuitive.
Right.
Financial strain, uncertainty about the future.
Yeah, absolutely.
Those are all major stressors.
It's huge.
But I'm curious, what specifically did the research reveal about the link between inflation and stress.
What's fascinating here is that it's not always about actual income loss.
Okay.
One study in Israel found that the perceived threat of inflation was actually more strongly correlated with stress levels
Oh, wow.
than actual income changes.
Interesting.
People were stressed about inflation's potential impact,
Right.
even if their personal finances hadn't been significantly affected yet.
So it's like this constant looming anxiety about what might happen,
Yeah, it's the uncertainty.
even if it hasn't quite hit you yet.
Exactly. It's that nagging worry in the back of your mind that erodes your sense of security and stability.
Yeah.
And as we know,
Yeah.
chronic stress can snowball into a host of other health problems down the line.
Right.
We're talking about increased risk of heart disease,
Yeah.
mental health issues, weakened immune systems. The list goes on.
It's like inflation casts a shadow
It does.
over your entire well-being.
Yeah, that's a good way to put it.
We've seen how rising prices can impact what we eat and how we feel.
Mm-hmm.
But what about the bigger picture?
Yeah, the big picture.
How does inflation actually affect our overall health outcomes?
Well, that's where things get even more concerning. And we'll delve into that right after a quick break.
Welcome back to the deep dive. Before the break, we were talking about how inflation can really amp up our stress levels, even if our incomes haven't taken a direct hit yet.
Yeah. It's that fear of the unknown, the feeling of being on shaky ground that can be incredibly taxing on our mental and physical well-being.
Absolutely. So we've seen how rising prices can affect what we eat and how stressed we feel.
Right.
But what about the big picture? How does all of this actually impact our overall health outcomes?
That's where things get even more concerning. Studies have shown a consistent link between inflation and decreased life expectancy.
Okay.
Essentially, as inflation rises, we see life expectancy trending downwards.
Wow, that's a pretty stark correlation.
Mm.
Is this trend universal, or are there certain groups that are hit harder than others?
There are definitely some nuances. One study suggests that this relationship between inflation and decreased life expectancy might be particularly strong for men
Okay.
in countries that already have lower life expectancies. It's a complex issue, and it raises some intriguing questions about why this might be the case.
We're seeing this gender disparity pop up again,
Yeah, it's an interesting trend.
and it definitely warrants further investigation.
Absolutely.
What about mortality rates in general? How does inflation impact those?
Unfortunately, the news isn't good there either. The research shows that inflation is linked to increases in overall infant
Wow.
and child mortality rates, especially in the short term.
Okay.
And once again, there's a gender difference. The impact of inflation on adult mortality seems to be more severe for men.
It's unsettling to see this pattern, emerging men disproportionately affected by the health consequences of inflation. Is there any insight into what might be driving this disparity?
While this specific review doesn't delve into the underlying reasons, it does highlight the need for more research in this area.
Right.
It's possible that societal expectations and traditional gender roles play a part.
Yep.
Men are often expected to be the primary breadwinners.
Right.
And that pressure can become immense during times of economic hardship.
That makes a lot of sense.
Yep.
There's a lot of societal pressure on men to be providers.
Right.
And when the economy is struggling, that burden can become incredibly heavy.
Yeah.
It can feel like their sense of self-worth is tied to their financial stability.
Absolutely.
And when that stability is threatened,
Yeah.
it can have a devastating impact on their mental and emotional health, potentially contributing to some of the negative outcomes we've discussed.
Exactly. It can really create a cascade of issues.
So we've talked about life expectancy, mortality rates, pretty heavy stuff. But what about the less tangible aspects of health? You know, things like happiness and overall well-being.
Right, the more subjective side of things.
Yeah.
That's where the concept of subjective well-being comes in. It's essentially a measure of how people perceive their own quality of life
Oh.
and happiness. And, as you might have guessed, the research paints a rather gloomy picture here, too. Inflation has a consistently negative impact on subjective well-being. People tend to feel less satisfied with their lives and experience a lower sense of overall happiness when inflation is high.
It's like inflation is this dark cloud hanging over everything,
Yeah, it can feel that way.
making it harder to see the bright spots.
It creates a sense of pessimism, a feeling that things are out of control.
Yeah.
And that can really take a toll on our mental outlook. And speaking of a bleak outlook,
Yeah.
we can't ignore the concerning correlation the study uncovered between inflation and suicide rates.
That's definitely one of the most alarming findings in this review.
It is concerning.
Can you elaborate on that a bit? Which groups are particularly vulnerable, and What does the research tell us about this connection?
The studies identified individuals over 40, and those who are unemployed as being particularly vulnerable to the mental health strains of inflation.
Right.
It's a grim reality, but it underscores how deeply economic pressures can impact mental health.
Yeah.
And in some tragic cases, push people to the brink.
It's a stark reminder that inflation is about far more than just numbers on a spreadsheet. We're talking about real lives, real struggles, real consequences.
Exactly. And as we've been discussing, those consequences are often felt most acutely by those who are already facing challenges.
Right.
The most vulnerable members of our society.
You've mentioned this theme of vulnerability several times.
Yeah, it's a recurring theme in this research.
Can you talk a bit more about the socioeconomic disparities that emerge from this research? Why are certain groups more susceptible to the negative health impacts of inflation?
It comes down to resources, or rather, the lack thereof. Low-income groups simply have fewer resources to cope with rising prices. They have less financial wiggle room, less access to support systems, and fewer options when it comes to making ends meet.
So if you're already living paycheck to paycheck,
Yeah.
a sudden surge in prices can completely derail your life.
Absolutely. It can mean having to choose between paying rent and putting food on the table or skipping essential medications because they've become too expensive. These are not choices anyone should have to make. But they become all too real when inflation takes hold.
It's a vicious cycle.
It is.
Inflation creates financial strain.
Yeah.
Which then limits access to essential things like healthcare and nutritious food, which in turn negatively impacts health outcomes, further exacerbating existing inequalities.
Precisely. And this cycle can be incredibly difficult to break. That's why it's so crucial to have strong social safety nets in place.
Yeah.
Programs designed to provide a buffer for vulnerable populations during these tough economic times. We're talking about things like food assistance programs, subsidized healthcare, affordable housing initiatives, policies that can help people meet their basic needs and weather the storm.
It seems like these safety nets become even more critical during periods of high inflation.
They do. The need increases dramatically.
Are current programs truly equipped to handle the increased needs and the rising cost of living?
That's a great question, and one that policymakers need to address urgently.
Yeah.
It's not enough to simply have these programs in place. They need to be adaptable and responsive to the changing economic landscape.
Yeah.
If the cost of food has gone up by 10%, but food assistance benefits remain the same, those benefits are no longer providing adequate support.
It makes you wonder if there should be mechanisms in place to automatically adjust these benefits during times of high inflation to ensure that people's basic needs are truly being met.
It's definitely a conversation we need to be having. We can't just set these programs and forget about them. We need to constantly evaluate their effectiveness and ensure they're meeting the needs of the people they're designed to serve, especially during periods of economic turmoil.
And it's not just about the immediate crisis, right?
Yeah.
The long-term consequences of prolonged exposure to inflation,
Especially
during childhood,
especially during those critical developmental years.
can be quite significant.
It could have ripple effects that last a lifetime.
Imagine a child growing up in a household constantly struggling with food insecurity and financial stress. The impact on their physical and mental development can have lifelong ramifications.
It can affect their health, their education, their future opportunities. It's a heartbreaking reality.
They might be more susceptible to chronic illnesses later in life,
Right.
struggle with educational attainment, and face a higher risk of mental health challenges.
It's a chain reaction of negative outcomes.
This really underscores the interconnectedness of economics, social policies,
Absolutely.
and public health. It's not enough to just focus on one area in isolation.
We need to see the big picture.
We need to address these issues in a holistic way.
Exactly. And that brings us to the crucial question of, where do we go from here?
Right.
What are the key takeaways for moving forward?
Yeah. What can we do with all of this information?
We'll explore those questions and more right after a quick break.
Welcome back to The Deep Dive. We've spent this episode exploring the complex ways inflation impacts our health.
Yeah, it's a multifaceted issue.
And it's clear that rising prices can create a ripple effect with consequences that go far beyond just our wallets.
Absolutely. It touches so many different aspects of our lives.
Absolutely. But before we wrap up,
Yeah.
I want to pick your brain about some of the broader implications of this research.
Okay, sure.
We've talked about the need for more research.
Right.
But what specific areas are you most curious about? What questions are still swirling in your mind after diving into all of these studies?
You know, one of the things that keeps coming back to me is the need to understand the long-term effects of inflation,
Okay.
especially on children.
Yeah.
We touched on this earlier, but it's worth emphasizing.
Sure.
If a child experiences prolonged periods of food insecurity
Right.
or lives in a household struggling with financial strain during those crucial developmental years,
Yeah.
what are the long-term consequences for their health as they grow into adulthood?
It's a big question.
It is a huge question. Could it lead to a higher risk of chronic illnesses,
Uh-huh.
affect their cognitive development, or even impact their mental health trajectory? These are critical questions
Yeah.
that demand further investigation.
It's like a ripple effect, isn't it? The consequences of inflation can extend far beyond the immediate crisis,
Absolutely.
potentially shaping the health and well-being of future generations.
It's a legacy that we don't fully understand yet.
Right. And another area I'm fascinated by
Mm-hmm.
is the persistent gender disparity we keep encountering.
Yes, it's a definite pattern.
Why does inflation seem to hit men harder when it comes to certain health outcomes?
Yeah, like suicide.
Like suicide and increased mortality.
Right.
Is it purely about economic pressures?
I mean, that's certainly part of it.
And these societal expectations placed on men as providers? Or are there other deeper factors at play?
That's what we need to uncover. It's a puzzle that deserves more attention.
It makes you wonder about the role of traditional gender roles and expectations,
Absolutely.
and how those might intersect with economic vulnerability. Are men less likely to seek help when they're struggling, for example?
That's a possibility. We know men often face barriers when it comes to seeking help for mental health issues.
Right. Are they socialized to internalize their stress in ways that are ultimately detrimental to their health?
It's a question worth exploring. How do cultural norms and expectations around masculinity play into these health disparities?
These are all fascinating questions that require a more nuanced understanding of the complex interplay between gender, economics, and well-being.
And we also can't forget the importance of considering cultural and societal contexts.
Right.
This review highlighted the need for more research in underrepresented regions, and
Yeah.
that's incredibly important.
Yeah.
We can't assume that the patterns we've observed in, say, Western nations will necessarily hold true in other parts of the world.
Of course not.
Different cultures have different coping mechanisms, different social safety nets, and different ways of experiencing and responding to economic hardship.
It's like we need a more global, culturally sensitive lens through which to view this issue.
Exactly. We need to broaden our perspective.
A one-size-fits-all approach simply won't capture the complexities of how inflation shapes health outcomes across diverse communities and societies.
You need to look at the local level.
Right. As we think about the global implications,
Yeah.
I keep coming back to the potential impact of inflation on healthcare systems,
Oh, absolutely.
especially in countries that are already grappling with limited resources
Right.
and struggling to provide adequate care.
It's a major concern.
As the cost of healthcare rises, you could put an even greater strain on these already stretched systems,
Yes, pushing them to the breaking point.
potentially leading to longer wait times for treatment, a decrease in the quality of care, and even, tragically, increased mortality rates.
It's a very real possibility.
It's a scenario that could quickly escalate into a full-blown public health crisis.
It's a sobering thought.
It's a sobering thought, and it really highlights the interconnectedness of these global issues. We can't afford to view inflation as just an economic problem.
We need to see the bigger picture.
Its consequences reach into every aspect of our lives,
Absolutely.
including our access to essential services like healthcare.
Exactly, and that's why this research is so crucial. It's a wake-up call urging us to move beyond simply acknowledging the problem and start brainstorming solutions.
What can we do?
We need to translate these findings into actionable policies and interventions.
Okay.
We need to advocate for stronger social safety nets, fight for equitable access to quality healthcare,
Yes.
and push for economic policies that prioritize the well-being of all members of society,
Right.
not just the privileged few.
This deep dive has been a powerful reminder that we can't just sit back and watch as inflation erodes the health and well-being of communities around the world. We need to act,
We do.
and we need to act now.
I couldn't agree more. This isn't a time for complacency. We need to engage in these difficult conversations,
Yeah.
challenge the status quo, and demand better for ourselves and for future generations.
I like that.
We have a responsibility to use this knowledge, to advocate for change, to push for policies that protect the vulnerable, and to strive for a world where everyone has the opportunity to not just survive, but to truly thrive.
Beautifully put. This deep dive has given us a lot to think about.
It has.
But it's just the beginning of the conversation.
It is. The conversation needs to continue.
I encourage everyone listening to continue exploring this topic, to stay informed, and to use your voice to advocate for a more just and equitable world.
We can't afford to be silent. The health of our communities, our society, and our planet depends on our collective action.
And on that note, we'll wrap up this episode of The Deep Dive. Thank you for joining us.
Thank you.
And until next time, keep asking questions.
Keep learning.
Keep learning, and keep diving deeper.